Hello everyone, today we are going to do tongue. So this slide contains information about external feature of anatomy, development and muscle, histology some and clinical facts about tongue. So this is how a tongue looks like, its external feature. There is this. There are numerous papillas present on the dorsal surface of tongue. The surface we are saying this is the dorsal view. So there are various papilla, for example, fungiform, filiform, foliate, circumvallate, sulcus terminalis, palatine tonsils, foramen cecum. So these are the various parts. When we study tongue, we divide the tongue into various parts. So this is anterior 2/3 part and this is the posterior 1/3 part. This is how we divide it. These two portions, that anterior 2/3 and posterior 1/3, is divided where this weave-shaped structure called as sulcus terminalis. This is how we divide it into anterior 2/3 and posterior 1/3. This is called as the posterior most part. So these features, that these papilla, they are specific in their site. Fungiform papilla are always present in the anterior aspect of the tongue, whereas filiform papilla, as the name suggests, filiform, they are maximum in number. Foliate are few in number as well as on the lateral aspect, and circumvallate papilla, they are actually 8 to 12 in number, and they are having maximum taste bearing buds. Next, when we talk about this, is the median glossoepiglottic fold. This helps in attachment with the epiglottis, whereas these two depression present over here, these are called as vallicula. Here this is the epiglottic fold present. This area is called as cecum. Next, this is the ventral surface of tongue. In this ventral surface, we are able to see the lingual veins. These are the deep lingual vein which help in the venous blood supply. Then here, these are the sublingual fold with the sublingual duct opening. These are numerous, as well as these two. These are the big opening present over here. This is actually orifice of the submandibular duct and the sublingual papillae. These big one. And this is the tip of the tongue. This is actually frenum present on the ventral surface, and this is actually fold called as plica fimbricata. Next, this is actually a diagram representing the development of tongue. When the tongue develops, it develops from the first, basically from the first, third and fourth arches. So the first arch like this, second is having a minor role, third arch and fourth arch. These arches, when they develop, from the first arch there is formation of two lingual swelling, whereas one foramen cecum is present over there and tubercular empire is present. In the fourth one, there is hyperbrachial eminence. The hyperbrachial eminence is divided into two parts. It actually elongate in the third as well as fourth brachial arches, and the third brachial arch forms the posterior 1/3 part of the tongue, as well as the fourth brachial arch forms the most posterior area of the tongue. So this is what I am telling you here. Next, this is actually the histological representation of the papilla which we were studying first. So filiform papilla, these are triangular in shape as shown over here. These are present in the anterior part. Filiform, there are numerous in number, whereas the taste sensations are less in this, but the number is maximum. So if I talk about their importance, if the filiform papilla are few or absent, the tongue becomes bald tongue. Means the absence, this is seen in many of anemias, bald tongue is seen. Then these are actually numerous. Taste sensation is good enough, but not maximum. And these are triangular in histological section. Then I came to know fungiform papillae. Fungiform papillae are also called as mushroom-shaped papillas. They are less in number, as well as taste sensation is present in this nominal. Maximum taste sensation is seen over here, that is the circumvallate papillae. These are few in number, like 8 to 12 in number, circumvallate papillae, and there is maximum taste sensation present over here, as well as the opening of von Ebner gland is present over here. So if I talk about where is the maximum taste sensation present, I'll talk about the circumvallate papillae. Next, now we need to know about the muscles. I'll show you a diagram. These are actually the muscles of tongue, which are actually very important. The muscles, when I talk about, these are divided into two parts, extrinsic muscles as well as extrinsic muscles. As the name suggests, extrinsic means external and intrinsic means internal. So, this is the diagrammatic view. Now I'll show you. And so, these are I am talking about now, extrinsic muscles. So, first of all, I'll talk about the palatoglossus muscle. Palatoglossus muscle, it is actually from the palatine aponeurosis, the origin. The origin is from palatine aponeurosis, whereas its insertion is basically on the side of the tongue. These are on the sides of the tongue. The main action of this is actually pull up the root of tongue. Next, if I talk about is hyoglossus muscle. Hyoglossus muscle is actually very important muscle, as this is the muscle which helps in the protrusion of tongue. This is the muscle that helps in the protrusion of tongue. Third is the styloglossus muscle. Styloglossus originate from the anterior surface of the stylar process as well as from the tip of the stylar process, as well as the insertion is into the side of the tongue. The basic function is retraction. Then if I talk about my next muscle, that is the genioglossus muscle. Genioglossus muscle is a very important muscle. The genioglossus muscle, I'll show you this in the diagram. Genioglossus muscle is a very important muscle. It is fan shaped and this is called as a life-saving muscle. Why I say so, life-saving muscle? Because this is the muscle that helps in the protrusion of tongue. As well as if this muscle fail, there are many chances that the tongue fall back and the person may die because of choking. So this is the important muscle, that's why called as life-saving muscle. It originates from the upper genial tubercle of the mandible, as well as when it comes to insertion, it divides into three parts, that upper, middle and lower. The upper fiber will insert in the tip of tongue, middle in the dorsum, and the third, that is the lower fibers, they insert into the hyoid bone. The main function is protrusion of tongue and it is a life-saving muscle. This is the genioglossus muscle which I was talking about. This is the genioglossus muscle. This is fan shaped. I am showing over here genioglossus. Now this is in the gist that I am showing all the intrinsic muscle as well as extrinsic muscle along with their basic action. So if I talk about extrinsic muscle as well as intrinsic muscle, so let's start it from here. Superior longitudinal. Superior longitudinal is the muscle that helps in the shortening of the tongue. It helps to shorten the tongue. So the tongue becomes short as well as the dorsum of the tongue become concave when there is use of superior longitudinal muscle. When I talk about the inferior longitudinal muscle, here the tongue became short but convex. In superior and inferior longitudinal muscle, both are the muscle that help in making the tongue short, but the superior one helps to concave the tongue, whereas inferior one helps to convex the tongue. When I talk about the transverse muscles makes the tongue narrow as well as elongated. Then when I talk about the vertical muscle, that makes the tongue broad as well as flat. Then the next is the extrinsic muscle that I have taught you earlier. Genio, hyo, stylo and palatoglossus. So the basic function of genioglossus is protrusion. It helps to protrude. Whereas hyoglossus help in the depression of tongue. And the styloglossus helps in the retraction of tongue, whereas palatoglossus help in elevation of tongue. So these are the things. Next, so must remember this extrinsic, intrinsic. Just imagine longitudinal will short, one will concave, one will convex. Transverse will make it narrow, transverse will narrow, vertical will broad. Genio will protrude, hyo will depress, stylo will retract and palato will elevate. And the main muscle to remember is genioglossus, called as life-saving muscle. Next is the diagram. This is the diagrammatic presentation which I was talking about. So let's see the palatoglossus here. This is the palatoglossus muscle. This is soft palate, circumvallate papillae. So this is inserting on the side of tongue, palatoglossus. This is styloid ligament present over here. From the styloid ligament, this is the styloglossus muscle. This is the styloglossus from the anterior part of the styloid process origination. It will originate. This is the styloglossus. This is the nerve, the ninth cranial nerve present over here. Then this is the lingual artery. This is lingual artery. This tortuous path is followed by lingual artery. So this is tortuous in nature. This is lingual artery basically. Then hypoglossal nerve. This is the 11th cranial. This is the hypoglossal nerve. 12th one. Then the middle constrictor muscles. External carotid artery. The external carotid artery is this one. Then the hyoglossus muscle. Important one, hyoglossus. Then the genioglossus, the life-saving one. This is the genioglossus muscle. This is the genioglossus muscle. This is the lingual artery which I was talking about. This is the lingual nerve along with the submandibular ganglion present over here. This part after, this is the tortuous part. After that, when it goes up, this lingual artery is called as the deep lingual artery. This is actually the sublingual gland. So this is all about the muscles. And I told about the ninth one, then hypoglossal nerve, the external carotid artery in this diagram. So next we will be doing, this is again the extrinsic muscles. In gist, they are telling about their function as genio will protrude, hyo will depress, stylo will retract and palato will elevate. This is actually a coronal section of the muscles showing the hypoglossal nerve, hypoglossus muscle, the greater cornu of hyoid bone over here, the genioglossus, this one. Then the inferior longitudinal muscles, these are the transverse, these are the vertical muscle and these are the superior longitudinal muscles. This is the styloglossus muscle present over here. So in gist, I told you about the basic function. Genio will protrude, hyo will depress, stylo will retract and palato will elevate. Next is this, again showing the function, like protrusion is actually the forward motion, that I place my tongue forward and I just push my tongue out of my mouth, that is protrusion. Retraction, that I am rolling my tongue back into my mouth, that retract, I am taking my tongue back, this is retraction. Elevation is called as the upward movement, depression is the downward movement. So this diagram is actually an important one. Why? just because this is telling me about the nerve supply and which nerve will supply. So if I talk about the anterior part, so general sensation is given by the lingual artery. But if I talk about the taste sensation, it is by chorda tympani. So lingual artery is for the general sensation, as well as I talk about the taste sensation, it is the chorda tympani in the anterior part. Then I talk about these are circumvallate papillae and the posterior 1/3. These are supplied by the glossopharyngeal nerve. Glossopharyngeal nerve is actually the 9th cranial nerve. It is going to supply the posterior 1/3 as well as the circumvallate papillae will be supplied by this. Then if I talk about the posterior most part, that will be supplied by the laryngeal nerve, branch of vagus. So the 10th cranial nerve will be supplying the posterior most part. The specific point that only palatoglossus is supplied by the accessory complex. It is supplied by the accessory complex, the palatoglossus. And the 7th cranial muscle, the 7th muscle of the tongue is supplied by the hypoglossal nerve. So this is, if I talk about the particular sensations, so glossopharyngeal for the posterior 1/3 as well as the circumvallate papillae. The posterior most part is by the 10th cranial nerve, whereas the anterior 1/3 is by the lingual as well as the chorda tympani. If I talk about the muscles, all muscles are supplied by hypoglossal nerve except the palatoglossus. Palatoglossus is the nerve which is supplied by the accessory complex. Next, I am talking about the lymphatic drainage. Lymphatic drainage, this is very easy to understand. First, I'll talk about these are the circumvallate papillae seen over here. Then this is actually superior belly of omohyoid. These are the muscles that you should know. Then this is actually posterior belly of digastric. So these two muscles, this one and this one, these two muscles, there is present this. This is actually a group of lymph nodes present over here. How you can study this? Let me show you. So if I talk about this, if I talk about the tongue, you have to drain your tongue. So this is the posterior most part, that is the circumvallate part. This, the circumvallate papillae. So this will directly drain into the adjacent lymph nodes. The adjacent lymph nodes from here is the jugulo-digastric lymph nodes. Here is the jugulo-digastric lymph nodes that are present over here. Easy to assess. After that jugulo-digastric lymph node, they will go into deep cervical group of lymph nodes. And after that, they will jugulo-omohyoid. So ultimate destination is actually the jugulo-omohyoid group of lymph nodes present over here. So this is the main destination. Why it is called as jugulo-omohyoid? As I told you that it is superior belly of omohyoid as well as this is posterior belly of digastric and the group of lymph nodes are jugulo. So jugulo-omohyoid. So main destination is over here. This is a good diagram, as this diagram will help you. If I talk about the anterior part, so where the anterior one will drain, the anterior one will drain directly into submental. If I talk about here, they will drain directly down. There are submental group of lymph nodes. If I talk about the side one will drain directly into the submandibular group of lymph node. This I have told you that this will into deep cervical group of lymph node. Ultimate destination will be jugulo-digastric, jugulo-omohyoid group of lymph nodes ultimately. So these are actually deep cervical group of lymph nodes. This is actually the lymphatic drainage which we have covered now. Next is, this is actually the taste pathway. As I told you that there are specific sensation, like from anterior there will be 7th cranial nerve that will carry, then from the circumvallate papillae and the posterior the 9th will carry, and from the posterior most part 10th cranial nerve will carry. Ultimately these are going into the nucleus tractus solitarius. And the ultimate destination is this nucleus tractus solitarius. After that, from this all the sensation are going into the thalamus, and this will stimulate the posterior central gyrus. So this is actually the taste pathway. This is the diagram representing it. Next, when I talk about the tongue, this is actually the clinical applied part. Sometimes the question asks to you if, for example, one side some syndrome happened, so how can I know which part or which side is being affected? So this is showing that if some syndrome happened and one side of the face got paralyzed, one side of the body get paralyzed due to it, so one side of group of muscles will be normal, whereas the other one will be affected one. So based on the pushed to the left side, so base is pushed to the left side by normal left genioglossus, the tongue will deviate to the paralyzed right side. Means this, my left side is normal one, but the tip of tongue will always deviate to the paralyzed side. This is the applied part. This will tell you if one side is paralyzed, the basic tip of the question, the answering is that the tip will always point out to the paralyzed side. The rest of the muscle will function normally, but the tip is going to always deviate on the paralyzed side. This is the tip. If the question is asked, mainly the clinical applied part is asked on this. In the end, I will say please like, share and subscribe. If you want any specific topic to be covered, you can comment and give me the suggestion in the comment section, and please subscribe it. Just the red button you need to click. Thank you.